Hello and welcome. I'm really excited to have you here where we're going to unpack the role of nutrition in the treatment of your inflammation and pain. So it might be you, or it might be your child, or it might be someone in your family, but today's going to be very helpful to get you to learn what the role of nutrition is. And you're no doubt here because, maybe you're frustrated, maybe you're overwhelmed, maybe you're confused. And if you're confused, I know what it's like because I've been there. There is such conflicting information about all the ways to eat, all these diets. There's paleo, vegan, keto, autoimmune protocol. I know from my experience, I had no idea which one to do because they all said they were the best, and the information just was very confusing. The other thing that I've experienced is it's really hard to isolate the effects of what we eat from other factors that affect our health. And, what I eat today may have an impact on me in a couple of hours, maybe tomorrow, or maybe the next day, and not really understanding why or how and having that ability to link it back makes it really hard to work through what foods are working and what aren't. The other thing is, like I just said, food doesn't affect us immediately. So it could take a couple of days. For some people, it could even be a week. It's not always obvious what foods are helpful and what foods are harmful, what foods are making our inflammation worse, and what foods are making it better. And the other big thing here is that we are all different. So I love that term bioindividuality. So our microbiome, so what's that? So that's all the bacteria in our guts. All of our guts are different. All of our hormones are different. All of our stresses are different. And our lifestyle choices and the foods that we like to eat are different. And that does make it a little bit more challenging because when we go to Dr. Google, then it's not taking into account of bioindividuality, which is absolutely essential for us getting on top of our inflammation. So who am I? So my name's Vanessa Vanderhoek. I'm what's called a functional nutritionist. So yes, I work with you on foods, but I also help work on other areas that I know are really, really important to your health, such as sleep and exercise and stress and other things like that. I've got these amazing life-changing whole foods programs. And really what I do is I help people, both themselves and help parents with their children, work with foods that fight inflammation. And I also help them work on those foods that are feeding their inflammation. And over the years, my 20 plus years career, I've been working with thousands of people, so helping them with their mindsets and getting healthy habits. And for me, it's really about equipping you to get to that point where you're adopting this as a lifestyle change and not feeling like it's a necessary evil or if it's a diet or anything like that. I come at it from a perspective of helping you embed this in your life so you have the best health outcomes that are possible for you. And this is my story, I suppose. I've got a 20-year or 25 plus years story myself of chronic inflammation, but it really came to a head in 2018, where our 2-year-old daughter at the time was diagnosed with an autoimmune disease. So if you've got one, you'll know what it is. But if you don't, what it means is basically where your body goes on the attack of itself. So hers was juvenile idiopathic arthritis, where her knee was incredibly swollen and it meant that she couldn't walk. So she had basically a stiff knee. She had no inflection. She's now been in remission since June 2020 and no flares for a very long time. And what we did was we focused very quickly on what's going on in there in her body. So her treatment, even at the age of 2, they go very aggressive. So it's methotrexate, which is a chemotherapy drug. And when she was prescribed it, her rheumatologist said, do not give it to her if she's vomiting or if she has diarrhea or if she's sick, basically, because it's an immune suppressant. The challenge we faced was she was always sick. So she was always coughing and sneezing and sick and diarrhea and vomiting. And so she could never take the methotrexate. And that's really what got us to that point where we said, what on earth is going on in there in her body? And I spent thousands of hours, over 10,000 hours, researching the power of the gut, autoimmune disease, nutrition, lifestyle modification. And as a result, we've witnessed a life-changing positive effect it's had on not only her health, but I discovered that my own health, I had been suffering with a level of inflammation for over 25 years. So for us, she's now in remission of the disease, which is absolutely fabulous. And it's the best outcome, obviously, that a parent could imagine for their child. What I want to touch on before I get into more of the nuts and bolts is, we mustn't forget that inflammation is a good thing in our body. So it's our natural defense system against those harmful invaders, and it is actually our body's natural healing system, which is triggered by our immune system. It's protective, it's healing. And usually if it's short-lived, if I fall over and bump my knee, it will get red and maybe there's some heat and pain and swelling. But that's because the white blood cells and everything going on in my body are there helping myself heal. Where it becomes a problem is where it's chronic. And I have no doubt that you're probably here today because you've got chronic inflammation. And that's where it's long-term and is lasting more than 6 months. And what I see in clinic is more and more chronic inflammation isn't just sore joints, sore back, things like that. It's also fatigue. It's also brain fog. It's also period pain and PMS symptoms. With many people, when we work on their inflammation and working out what the root cause is and addressing it, I found with many of my clients also some of their anxiety has reduced or been alleviated as well. So inflammation isn't just the redness, heat, pain, swelling that we often think about it. It's also many of these other things. Headaches is another big one that I see. Acne, pimples, the list goes on. What I want to share with you is something that's really important. And if you are going to go down this path of really working on treating your chronic inflammation, it's by recognizing that it's not going to happen overnight. Okay, this is a lifestyle change. You will get your inflammation levels down if you can work on what the root causes are. Well, I hope you can. That's what the goal is. We try to help you to get your inflammation levels down. But you've got to be consistent and persistent. And it's not going to happen overnight. It may take 6 months, 12 months, 2 years, 3 years. But it's about that consistency and persistency and having a plan. So here are the confluence of factors. There's so many factors that could be contributing to your inflammation. It could be your gut health. Over 70% of our immune system rests within our gut. That's why I called myself the healthy gut nutritionist. At the beginning, I was called something else. And within a couple of weeks of practice, I changed my name because I was like, no, the gut for me is where it starts. And if you haven't done a microbiome mapping, which is a stool test of your gut, you don't know what's going on in there. You don't know what bacteria you've got, good and bad. You don't know if you've got parasites, worms, yeast, overgrowth of other things happening in there, which are impacting your immune system. Food allergies, food intolerances, and food sensitivities play out big time with inflammation. So if you've got an allergy, you probably know about it. So there are people, you know, who often are needing to carry around EpiPens and things for peanut allergies, etc. But intolerances and sensitivities for food are less known. I didn't know I had a sensitivity to eggs until I did one of my own detox programs. And I took it out, and then when I reintroduced it, my goodness, did I realize that that was causing some of my challenges. Now, it's not forever. Eggs are not going to be a problem for me forever, but until I got my gut into a state where the bacteria were happy with the eggs, then it was going to be a challenge. Hydration, we've got to drink a lot of water. So on average, you know, it's about 2 liters a day. So we want our cells to be healthy and well. We've got trillions of them. To do that, we have to drink water. So that's an easy win for you to get started today, is up your water intake. Make sure you're having at least 2 liters a day. And if you're exercising, it might be even more. If you've got infections or if you've had infections, then that can impact, can trigger inflammation, but it can also make it worse. And they can also lay dormant in your body and you may not even really realize what's going on there. Lifestyle factors. So things that I put into this bucket are things like your exercise. It might also be smoking and alcohol use. It might be social. You know, do you have a good social network? People who often don't have a good social network do have worse outcomes with regards to their health. There is an intrinsic link. Deficiencies with regards to vitamins and minerals, and also macronutrients like fiber, fat, and protein make a big difference into your inflammation. Stress and resilience. And look, when we think about stress, many people say, oh, stress at work or stress at home. Stress, there are so many different stresses. It could be the stresses from a chemical perspective from the bushfires. It could be stresses from mold, or could be stresses from noise. You know, and I know many people who struggle with noise, for instance, and that really puts their nervous system into overdrive. It could be stresses from, I'm just trying to think on the spot here, could be stresses from food. You know, it could be from all different aspects. Injury and trauma can also obviously cause inflammation. And in the case of my daughter, she had a fall. And the fall and that injury and that trauma was what I would call the straw that broke the camel's back. And we see that a lot, that, you know, it takes one thing for, you know, a person's immune system to tip over the edge. Sleep has a massive impact on your immune system and your inflammation and your ability to relax, also your genetics. So epigenetics is an area that I'm very interested in. I'm looking at doing my PhD in this particular area. But because we've got specific genes, or because particular conditions are in our family, doesn't mean that those genes are always expressing, or those genes are, if I can say it, turned on. We can influence our genes and our epigenetics based on what we eat and our lifestyle factors and our sleep and our exercise, and minimizing the toxins in our environment, etc. And the last couple of factors, and these are last but not least, are how we were birthed. So, you know, if we were born vaginally and breastfed, then our gut is going to be different, our bacteria is going to be different. And, you know, that has a big impact on our immune system and our levels of inflammation, or our ability to meet us where we need to be with regards to chronic inflammation. And of course, you no doubt have heard about antibiotics. So antibiotics are a savior. When we're sick, we need them, but they are like a nuclear bomb going off in our guts. They don't know which are the good bacteria to bad bacteria to wipe out, and which are the good ones. And it can impact our levels of inflammation for sure, because there's many good bacteria in our gut that we need to help modulate these things. So they can play a factor, but of course, they're a necessary evil. We do need them. So what I want you to really understand is there's not a one size fits all approach. And that's why when we go to Dr. Google, it's confusing, because for each of us, and it goes back to that individuality, that the foods and the drink we consume either feeds or fights our inflammation. Okay, and it's going to be different for all of us. And it's going to be different maybe in a year for you, because that microbiome, that really important part of our body in our gut, where the bacteria and the yeast and the fungi and the bile and the enzymes all meet together with the foods and the drinks we consume, instruct our biochemistry. And it's so powerful at that level of what's going on. And it's different for all of us because that makeup, hormones is another one that's happening in there. It's different all the time. So what's the difference between allergies, intolerances, and sensitivities? And I just touched on this briefly before, but food allergies, they're the most immediate and they're really potentially severe. So if you've got an allergy, most likely you know about it. And if you do have a response where your doctor thinks it is an allergy, you will see an allergist because it's very serious. Food intolerances, they don't directly involve the immune system. So this is basically where our body's unable to digest foods or is irritated by them. And sometimes they're kind of just left there to rot in our guts. And sometimes people get extra bloating and they feel yucky and they pass gas and things like that. Whereas food sensitivities, they are immune mediated, but often there's that delayed reaction. So it could be a couple of hours or it could be even a couple of days. So what are some of the symptoms? And as I mentioned earlier, this can show up as inflammation. So bloating, runny nose, headaches, migraines, joint pain, muscle pain, fatigue, feeling exhausted in the morning, but also feeling that 3 p.m. slump, rashes, acne, skin problems, stomach pains, constipation, diarrhea. So some people alternate between the two. Even reflux can be a sign. Anxiety and also depression could be a sign. It's not saying it is the reason, but all of these could be symptoms that you've got an intolerance. So you can help lower your inflammation by changing your diet and your lifestyle. And what we do is we work out and eliminate what's feeding or increasing inflammation. So what's hurtful for you today? Not saying that it'll be like that forever, but at the moment. And by adding in those foods that we know that, or trying them, that may help fight inflammation. So those foods that are helpful. And remember what I said at the beginning, bio-individuality is key. So what is helpful for you might not be helpful for me. It might actually be quite hurtful for my system. And it's really important that we do remember that, because there most certainly is not a one size fits all. So how can I help you? So there's a couple of things here. So obviously, I work with you as a one-on-one in a consultation in the clinic. You can do a group program. So I do run the anti-inflammatory elimination diet group program on a regular basis. So you can join that. But here are some other things that you can do. So 2 to 8, you can start today. So maximize your hydration. Okay, we hear often drink more water, but it is so, so, so important. It's going to help your cells, it's going to help flush out toxins, and it's something that you can do straight away and it doesn't cost you money. Eat the rainbow of colors. So when I say the rainbow colors, I mean think about all the different colors of fruit and vegetables and work through, in a week, are you eating those colors? And if there's particular colors you're not eating, maybe it's green, maybe it's white, maybe it's yellow, purchasing them and having them in your house. So that way you're getting that exposure. By eating the different colors, rainbow of colors of fruit and vegetables, you're going to bring in more nutrients and vitamins. I want you to think about how you can reduce processed foods, and you might not eliminate, but how can you improve the quality, but also reduce them as much as you can. Fat, fiber, protein with every meal. So making sure that you're having a little bit of each of those. And of course, in my programs, what I do is I unpack this with you more. You get menus, you get recipes, you get guides, you get more structure around what this actually looks like. So if you need some more support, then I'm going to share with you in a moment how you get that. Remove inflammatory foods, add in anti-inflammatory foods. So we do that in the programs. And then also address lifestyle factors. So are you getting enough sleep? How can you get more sleep? Are you exercising? How can you bring in more exercise? Are you smoking? How could you reduce that? Are you drinking alcohol every day of the week? How could you reduce that? What are some of those other lifestyle factors like your stresses? What are they? Call them out and work through how you can put in some mechanisms to either reduce, cope with them, or eliminate them. An elimination diet is a great way of helping your inflammation. And I'll tell you why, because we're going to bring in those foods that we know are anti-inflammatory on that as part of this program. But also what we're going to do is take out foods that we know for many people are inflammatory. So by taking them out, then what it's going to do is lighten the load on your system. And then as we reintroduce them, you can detect for yourself if there's any intolerance or sensitivity. So this is the gold standard, doing this in a really carefully planned and executed way. And, if it's for you or if it's for your children, what we've got are the recipes there that are going to help you with navigating that. Because I know for many people, it's pretty scary changing, what you're eating and all these different and new foods. But I guide you through that. Many people today are deficient in essential nutrients and minerals. It's just a fact that the soil that we have, the way that food is grown, and agriculture, manufacturing, it's just resulting in this congruence of factors that's resulting that not only are we not taking in and ingesting enough nutrients and minerals, but also for many of us, we're not absorbing them. I know that eating and lifestyle habits are difficult to change often. I've been there myself. We had to radically change the way that we ate, but the benefit was significant and I wouldn't change it for any other way, because what we got out of it with my daughter's health and my own health was phenomenal. But I also know, working with hundreds of people, that this is really challenging, and I bring with my coaching empathy, and we do it in such a way that you and I work together, that we are able to work on changing the things that matter the most, so you can get some quick wins and work and have a plan to reduce your inflammation. And at least try to reduce your inflammation through nutrition and lifestyle habits. So the question is, do you know what foods and recipes to eat? Do you know what lifestyle changes to make? Do you have a cheer squad? Do you have support? Do you have someone to guide you through this? Do you have someone who's been through it themselves, who knows what you're going through? And do you have tools to monitor? So do you, if you're starting to go down this path, will you know what foods are helping and what are making things worse? So I want to remind you why you're here and why you're watching this. And, maybe it's you're frustrated, overwhelmed, and or confused. But what I do know is you do want to reduce your inflammation. You want to try and reduce your inflammation as much as you can, and your pain. You want to regain your health and you want to improve your quality of life. I know what it's like. I've been there. And, this is kind of how I see it. You've got one option: if you keep doing what you're doing and, keep going down that path and see where you go. Or your second option is to get expert nutritional support and guidance. So if you want to move down option 2, I'm here for you. So my business is called The Healthy Gut Nutritionist. I'm now at the World of Wellbeing Clinic at Woden in Canberra every Tuesday and Friday, so you can see me in person if you prefer. And what you can expect from us working together is you're going to start to understand what foods work and what foods don't, what foods help and what foods hinder your inflammation. You will start to establish healthier eating and lifestyle habits. Many of my clients have symptom relief, within 3 or 4 weeks. Many have more stable energy very quickly as well. Most of them have fantastic sleep quality pretty quickly within 2 or 3 weeks, and they feel less stressed and overall happier. So here's some of the questions that I often hear. So I've tried lots of things so far. How is this different? So this is not a diet. This is a lifestyle program. What we're going to do is work through a gentle whole foods detox, and we are going to work out what foods work for you and what don't. You're going to get recipes, you're going to get my guidance, you get access to an app that you can put on your phone if you choose to, where you can be in contact with me every day if you want. In that app, you can share what exercise what you're doing, what food you're eating, what your poo is like if you want to use the app to that level. I don't get many people using it to that level, but I do get some. Who are very invested in this. And it's great if you want to use it. So this is up to you. So if you want to have a light touch with regards to how we work together, that's fine. But if you want extra support, that is also the way that I work. Why is the gut so important to my inflammation? So that's another big question that I get. So when people say, well, if my knee is sore, what on earth has that got to do with my gut? And it comes back, it's highly complex. Okay. So I'm going to simplify it in the most easiest way that I can cover in a couple of minutes. But essentially, the majority of your immune system is in your gut. Okay. And if you think about your gut as your protection from the outside world, so, your skin on your body, basically you're hollow on the inside. So you're kind of like a donut. You're hollow the whole way down. So from your mouth to your anus, you're hollow. And that's your gut. So what you put in your mouth, basically, if there's an inflammatory response in your gut, in this hollow part, and it's inflaming your gut wall, it's called your epithelium, then what's going to happen is there's going to be a response. And for some people, proteins then can escape through your gut wall and into your bloodstream. So what happens then is they escape and they go to that point in your body, which is your Achilles heel. So if it's your knee, then your knee will get really sore. So that's why the gut's so important. We want to make sure that we're reducing any upset in your gut. How can you best prepare for our sessions? So, it's about, there's forms in the app, so you get to complete those. And it's about coming to the sessions open-minded, but also reflective. So this is a really, like I said, it's a transformational program, but you've got to be really in tune with your body. You've got to be intuitive. So if you're coming saying, look, I don't know what I ate and I don't know the impact that it's had, we're not going to really get a lot out of our sessions. So it's working through, again, it goes back to that light touch, heavy touch. What do you want to be getting out of this? And I'll help you in our first session plan for how we work together. Will you give me meal plans? Look, I won't give you meal plans per se, but I'll give you recipes. So there'll be lots of recipes, lots of snack ideas, lots of meals that are easy to make very quick to make, one pan wonders. But also things that if you love cooking and you're an accomplished home chef, then there will be some in there as well that you can feel like you're treating yourself in the cooking department. And then how will I know it's working? So you'll know. So you'll know because some of those symptoms that you have will start to reduce. And of course, that's why people are raving fans of my programs, because they work. And you'll know it's working because your symptoms will shift. So do you want to know more? So what I'll do is I'll put a link below. So if you'd rather contact me and have a conversation, 10, 15 minutes to explore if working together is going to be right for you or your child or your family, get in touch. Okay, so I'd love to talk to you. Just go online, you book a time, and then what we'll do is we'll have a conversation to see how I can help you. The couple of ways, like I said, I can help you is either one-on-one. So I can do that in the clinic in person. I can do it via Zoom. So if you want to meet via teleconference, I'm more than happy to do that. You can book for that online very easily, or you can do a program. So I've always got programs going on. I've always got a detox program. And then, like I said, a couple of times a year, I do the anti-inflammatory elimination program. So if that's something that you're interested in doing, you can have a little bit of more of a read, check the timing to see if the timing works for you, and book in. So yeah, if you want to do it, book it in, take action, and I'll be there to help you. So like I said, any hesitation whatsoever, you want to know more, you want to have any of your questions answered, the best thing to do is to reach out and make a time. And that way we can work through what the best approach is going to be for you. So thank you for your time today. I hope it's been helpful, and I look forward to seeing you soon. Bye.